Ooh, ah.
Hello everybody, it's Ryan Liberty and welcome back to my series, Everything You Need to Know About Trauma. In this section of the series, we're going to be talking about trauma and stressor-related disorders, specifically who is at risk for developing them. Trauma and stressor-related disorders are what we wind up with when we're not able to effectively cope with going through a traumatic stressor or traumatic experience. Trauma and stressor-related disorders have a number of factors that determine whether or not they emerge, and those factors are known as resiliency. Those factors come in three separate stages, and they are the pre-traumatic factors, which is what happens before we experience a traumatic stressor. There is peritraumatic factors, which are when we are in the middle and experiencing a traumatic stressor. We're right in the middle of it. And post-traumatic factors, which are what happens after we've already experienced the traumatic stressor. Altogether, those stages add up to resiliency, and that will determine whether or not we effectively cope or we wind up with a traumatic or stressor-related disorder. Pre-traumatic factors. Pre-traumatic factors are factors that already exist in our lives before we experience a traumatic stressor. There are three factors that we know consistently show an increased risk of developing post-traumatic stress disorder, also known as PTSD. Those are psychiatric history, family psychiatric history, and childhood abuse. There are other factors that may slightly increase our risk, but more studies need to be done, and those include female gender, social disadvantage, educational disadvantage, intellectual disadvantage, and previous adversity. It's important to note that although pre-traumatic factors are significant in determining whether or not we have the risk of going on to develop a trauma and stressor-related disorder, peritraumatic and post-traumatic factors weigh more heavily in determining that risk. Peritraumatic factors. Peritraumatic factors are the factors that will determine your risk of developing a trauma and stressor-related disorder while you're going through the trauma, while you're experiencing the traumatic stressor, when you're in the thick of things. And these factors are reliant upon the severity of the trauma that you've experienced, which is composed of a bunch of different things. So first you have your level of exposure to trauma. And this could be something like, were you only hearing details about somebody else going through trauma? Maybe you witnessed somebody else go through a trauma. Maybe you were threatened with serious injury. Maybe your life was threatened, or maybe you actually experienced serious injury, or you experienced a situation where you could have died. So that scale there is going to increase your risk as you go higher up the scale towards actual possibility of death in your life. That is one thing that's going to increase your risk towards developing a trauma and stressor-related disorder. Something else that's important is the duration of exposure to trauma. So the length of time that you had to cope and sit in that experience of a traumatic stressor. And also, if you maybe had more than one traumatic stressor over a period of time, maybe multiple, maybe this went on for a couple of weeks, maybe a couple of years, the length of time is going to increase your risk for developing a trauma and stressor-related disorder. Something else to consider is the allostatic load. And the allostatic load is the way that you experience stress inside your body during trauma. So all of those hormones that get released, and as they build up in your body, if you never have the chance to calm and release them, that will increase your risk for trauma and stressor-related disorder, the more allostatic load that you have built up. Finally, another factor in determining the trauma severity is your ability to cope with the trauma while you're experiencing it. So things like emotional regulation skills, your temperament, your personality traits, your ego defenses, all of that put together will determine how severe the trauma is. And if you're better able to use those things to cope, that will decrease your risk for developing a trauma and stressor-related disorder. So all put together, the severity, the level of severity of the trauma is what's going to determine your risk for trauma and stressor-related disorder. Post-traumatic factors. Post-traumatic factors are the factors that happen after we've already experienced the traumatic stressor, and like all the other factors, they're going to contribute in our risk of developing a trauma and stressor-related disorder. There is one factor in particular that has been consistently shown to significantly increase the risk of post-traumatic stress disorder, also known as PTSD, and that is having a lack of social support after trauma. Something else to consider, and something else that will affect your risk, is whether you do avoidance or approach coping after the trauma. Approach coping is when you lean into the traumatic stressor and you go towards experiences that remind you of it and handle them in a safe environment, such as with a therapist, and experience the emotional dysregulation and learn to manage your emotions and come back into peace. Now, avoidance coping is the opposite, and avoidance coping is what is going to increase your risk of developing a trauma and stressor-related disorder. Avoidance coping is when you avoid things that remind you of the traumatic event and you don't handle the emotional dysregulation that occurs after trauma. Resiliency. Resiliency is when we take our pre-traumatic, our peritraumatic, and our post-traumatic factors and we put them together into one whole unit. Resiliency is going to determine our risk for developing a trauma or stressor-related disorder, or whether we will go ahead to cope and go on with life as usual. While there are many factors that are outside of our control, there are also a lot of factors that are in our control, including emotional regulation skills, having a support network, a social support network, and choosing approach coping to handle the emotional dysregulation that happens after trauma. If you're finding this information helpful, please continue to watch the rest of the series and subscribe to my channel.